So this person's comment, like, I have total respect for those of you that can like safely birth at home. That is like a real option. And I know there are like centers here that you can go to where it's basically like all the things are there in the event that it turns to needing medical attention, but it's essentially like birthing at home. And for those that get to do that, like, can I just say how jealous I am? Because what an amazing experience to have not all of the interventions possible. My pregnancy was not one where that was even an option. I went on bed rest at week 10. I stayed there until week 32, where along the way I also had some support to stop contractions at week 28 with medication, and then delivered at week 32 via a C-section. My sister had a similar not amazing experience where her first one, she went to the hospital, they got sent home, went back to the hospital 24 hours later, sent home again, back to the hospital. Finally on the third day they decided to keep her. Knew that something wasn't going well, finally ended up after like 9 hours in an emergency C-section where she almost bled out and died on the table. And the moment my dad walked in the door, because my sister and I don't have the same blood type, they asked for my dad to do a blood donation so they could immediately give it to her. And then with her second one, they started with trying to do what's called a VBAC, a vaginal birth after a C-section. And it also ended in an emergency C-section. I think sometimes we forget that prior to hospital births, the rate of death of the mother in childbirth was like 30%. So I just want to keep that in mind when we're saying we're so against like birthing at the hospital. Like 30%, that's a lot of babies with no mama. The point of the video that this comment comes from is that sometimes we don't know the value of saying, I would like the cash pay price, and not telling anyone that you have insurance until the moment you decide, no, this is cheaper with my insurance. Because you can call the doctor's office and you can get the billing codes that they typically bill during a vaginal birth and during a C-section birth, and then typical stays afterwards, and you can call the hospital and talk to them about what codes they usually bill, and then you can call your insurance company and price that all out. And then after the fact, you can take all of the bills, because you would still ask for an itemized statement. You can take all of those bills and submit them on your own to your insurance company and try and get reimbursed, because honest to God, my out-of-pocket was $26,000 in 2010. The hospital paid another $200,000 for all of the care that was needed for the one that ended up in the NICU. Just know that you have options and you have the right to ask, and you have the right to ask as well for a payment plan on those things.